Hello, I'm Dr. John Hancock, Executive Dean of McGovern Medical School. Artificial intelligence, or AI, is increasingly impacting many aspects of our daily lives. In this context, AI has enormous potential to provide innovative solutions to age-old medical problems. Researchers in the Department of Internal Medicine at McGovern Medical School are now harnessing the power of AI to aid in the diagnosis of inheritable thoracic aortic disease. Let us hear more from our research experts.
I focus on a group of conditions called HTAD, or heritable thoracic aortic disease. And it's a group of conditions that predispose to developing aortic aneurysms and dissections. These are rare conditions. For example, there's something called Marfan syndrome, Loeys-Dietz syndrome, vascular Ehlers-Danlos syndrome. They're all caused by different genes, all have different features, but kind of a unifying feature is this predisposition to aortic and arterial aneurysms and dissections. So I'm involved in trying to discover new genes, new conditions, but also in finding ways of identifying these at-risk individuals earlier. Very important to have an early diagnosis of these types of conditions, because now our management has improved significantly, even over the last 15 to 20 years. And so these affected individuals are living longer and healthier lives. We've focused mainly so far on vascular Ehlers-Danlos syndrome because there's actually been a great deal of support within the VEDS community for developing a tool like this. And because of that, we've been able to get many images, many facial images of patients with vascular Ehlers-Danlos or VEDS across different age groups, different ethnicities, and different sexes. And that's really key in developing a tool like this. So we have these images that we're then able to use to train our AI model to recognize the characteristic features of VEDS or any other condition, and then use that to differentiate from kind of the general population. When you pull out your phone, you take a picture of someone, frequently the AI within your phone is able to recognize who is who in that picture, and it can tag them with their name. So the technology exists for this, so we wanted to adapt it for this specific use case. Specifically, we're using artificial intelligence and what we call AI facial analysis to recognize these individuals that are at risk. The general medical community is usually not as familiar with a lot of these characteristic facial features. So we wanted to come up with kind of a standardized way that anybody could use some kind of AI tool to recognize these features and use it for screening purposes for early diagnosis. The key is we need to know who is at risk. Someone in the pediatrician's office seeing a child, or a school nurse maybe doing a sports physical, or even an emergency room doctor seeing a patient who comes in with chest pain. They can use this and quickly get an idea of whether someone might have an underlying condition like this. The goal of our overall study is to define these facial phenotypes, we call them facial gestalts, for all of these different types of HTAD conditions, Marfan, Loeys-Dietz, VEDS, and others, and then implement this in a free accessible platform, ideally a mobile app that can be used on your phone, and then use that to identify people early on and then start guideline-based management. It will really allow us to continue to improve the overall outcomes of these patients and let them live longer and better lives.
McGovern Medical School researchers are using the latest technologies to advance diagnostic accuracy and therapeutic options. We are now truly on the threshold of an amazing intersection of medicine with artificial intelligence. Thank you for joining me for this episode of Hancock's Headlines.